consideration in the main implementation is which patients we should not be treating, right? And that's, I think it's a very important question, because we have another highly positive trial for large core EVT, and in this trial, the main advantage to the previous ones is that it had a more pragmatic approach. So it was only non-contrast CT. So now we have all these trials suggesting high benefit of EVT in large core EVT patients. So again, we shouldn't withhold treatment for those patients. To be honest with you, I think it comes down to the capacity issues, right? So it comes down to the healthcare systems to see how they can, keep up with the increasing volume of EVT cases. And of course, the other big thing that is going on are the two MeVO trials, the ESCAPE-MeVO and also the DISTAL trial. And if they come back positive and we'll start treating, distal occlusions, this was going to lead to another increase in the EVT volumes. So taking, let's say, for example, thrombolysis as an example, we started with very strict inclusion-exclusion criteria. A lot of subgroups were excluded, people more than 80, the ones that they had like diabetes, those after 3 hours. But now we have, broadened the eligibility criteria. So I think the same is also happening here for EVT. So I do foresee in the future that, you're not going to ask questions about previous disability or the questions that we're asking now, and we'll just going to treat almost everybody. If there is brain to save, we'll just try to get the clot out, right? I can tell you about locally in Hamilton. So, of course, resources are limited because resources are always limited. But I can say that we're pretty good in implementing results from new trials. And from day one after the publication of SELECT2 and DISTAL aspects, we started treating people with large cores, right? So we wouldn't turn them down. Up until now, I think we're doing really well, so we don't have any capacity issues. But I do see that if the MeVO trials are positive, maybe we'll need more manpower, better infrastructure, and all those things to be able to deliver our patients the best care that they need to have.